But also the Deputy Director of China's National Health Commission, Li Bin, is presently addressing a press conference on the measures being taken in China to address this outbreak. Let's listen in.
Strengthen community-based prevention control, and we will strictly manage all personnel that have traveled to other parts of the country from Wuhan in the last 15 days. We will make good use of community committees to track the personnel and put them on registration book. And in case of abnormalities, they will be transported to medical conditions for isolation and screening. And we will also stress the prevention and control of the disease in rural areas to prevent the outbreak in the rural regions. And thirdly, we will make utmost efforts to strengthen the treatment of patients. We will put all patients in critical conditions in the best hospitals in the locality, or ask the best hospitals in the locality to send a whole team of doctors for critical and respiratory diseases to conduct 24/7 surveillance of the suspected patients. And we also make good use, combine traditional Chinese medicine and Western medicine to reduce the case of critical infections and death cases. The medical workers in Hubei, especially in Wuhan, have fought for many days on the front line. They have made utmost efforts to treat the patients and demonstrated a lofty spirit of love and compassion. In the coming 2 days, we'll send 12 teams of 1,600 people to the region. And the relevant materials are also being coordinated. They will be put in place in time. Disease is the order, and prevention control is the responsibility. We'll make utmost efforts to enhance prevention control and make full use of the strength of the system socialism with Chinese characteristics, and build on the experience we have gained in the past to win a people's war against the disease, relying on the efforts of the medical workers and the people of the whole country. Thank you. Now the floor is open for questions. Please identify your media affiliations first. Thank you. With CCTV. Yesterday, the Standing Committee of the Political Bureau of the Central Committee has made very important instructions on the disease prevention control. What follow-up measures will be taken?
Well, for every deployment, we need to make efforts 9 times that to fully implement the decision by the CPC Central Committee is crucial for containing the spread of the infections. First, we need to leverage the advantage of our system, and the Central Committee has decided to establish a leadership group to contain the spread of the infections and send a guidance group to Hubei province. We also have an interagency mechanism in response. This interagency mechanism could help mobilize the supplies and medical materials to ensure the needs at the front line. Second, we need to implement the responsibilities of the local authorities, in particular the responsibilities for the local party organizations. And this principle is necessary, and it is in accordance with relevant laws and regulations, and is highly crucial for the containment efforts. As we have learned, the different provinces have already established their leadership mechanism with their party secretaries and provincial governors as the principals. And third, we also set up interagency mechanisms. We have exercised monitoring for the first round at the various localities. The interagency mechanism will continue to carry out supervision and surveillance efforts, and we would also send working groups to the different localities to provide guidance and directions. And I want to point out that since the outbreak, the medical and health workers, as well as the general public, have worked closely in coordination with the government and created favorable conditions for containing the virus. And we believe under the strong leadership of Comrade Xi Jinping and the CPC Central Committee, we will be able to win this battle against the infections. Let me also add a few words. Yesterday, the Standing Committee of the Political Bureau of the CPC Central Committee held the meeting, and the Ministry of Transportation also held its meeting to follow through on the directions of Secretary General Xi and the Political Bureau. The outbreak is a call for action, and prevention and control our responsibilities. Over the past few days, our minister and the vice minister held 6 working meetings through various teleconferences and to rally and mobilize the local authorities, especially the transport authorities in Hebei province and especially in Wuhan. Well, first, we have promptly carried out deployment for prevention and control of the disease. A few days back, we have activated the level 2 control and prevention mechanism and made relevant directions. We have issued notice for ventilation, disinfection, and temperature screening for the travelers at all the transportation hubs, including airports, train stations, coach stations. In particular, given the Spring Festival, we are paying more attention to the situation, and we hope the travelers can do more to protect themselves, to make good plans for their travel, and to cooperate with the screening and the testing at the transportation hubs. And with concerted efforts, we believe we will win this battle against the virus. Let me also add a few words. The Ministry of Information and Technology and Industry has attached great importance to the outbreak because we are now in the Spring Festival holiday, and we face a severe shortage of supplies given the high demand. So we have taken some measures to address that. First, we have mobilized all the information technology system across the nation to overcome the difficulties. And all the factories and producers have overcome all the difficulties to resume their production. And we have also worked vigorously to establish a temporary reservoir of supplies to ensure sufficient supplies and purchase. And fourth, we also asked the e-commerce platforms to keep their prices reasonable and ensure sufficient supply so as to ease the shortage of supplies, especially on the e-commerce platforms. In addition, we have done everything we could to ensure the medical supplies in Wuhan. Although there is this strong demand and a relative shortage of supplies, we have done a lot to address this problem, and we have received a list from Wuhan, which include 4 categories of materials and supplies. Well, most of these supplies can be met, basically, but for protective suits, masks, the shortage is quite pronounced because we all know that China is a big producer of those commodities, but because of the Spring Festival, the production capacity is not fully tapped. Well, because of our mobilization efforts, we have been able to get 40% of the production capacity back in place, but the supply of protective suits are difficult to meet the demand. And the demand from Hubei is about 10,000 protective suits every day. So that is 3 million every month. But in China, only 40 producers from 14 provinces can produce 30,000 protective suits every day. After 40% of the production capacity restored, we can only meet part of the demand. So the problem is pretty challenging. In addition, we also have some exporters who can produce 50,000 protective suits every day, but those are for overseas markets. They do not meet domestic standards, so it would take time to make adjustments. So going forward, we will try to do everything in our power to ensure sufficient supplies to meet the demand. After we have learned the shortage of supplies, our relevant team are really at pains, and they couldn't sleep well, and they would do everything they can to ensure sufficient supply. First, we would tap into the central authorities' reserve to meet the demand at the affected province. And second, we would do everything to resume the production, to raise the production capacity from 40% to the normal, to full capacity. And also, we would try to bring the exports that meet overseas market standards in line with our domestic market standards, so that those exported items can be used domestically. And fourth, we also want to step up international cooperation. We are already pushing for overseas purchases to meet domestic demand. And any foreign journalist?
Thank you. Two questions from AFP. The first is about transport restrictions. So currently a number of cities have announced a variety of restrictions on inter-provincial buses, public transport, and of course Wuhan now is under effective quarantine. So the question is, will these restrictions expand to the whole country? And the second question is about the severity of the new coronavirus epidemic. Will the novel coronavirus epidemic be more severe than SARS in terms of death toll and number of people affected? Thank you very much.
好，请把问题翻译一下。
您好，我是来自于法新社的记者。我有两个问题，第一个是关于交通限制的问题。我们知道有一些中国的城市已经开始实施公共交通以及城际交通等方面的限制措施。我想问的是，这样的限制措施是否会推广到全国？第二个问题是关于新型冠状病毒肺炎疫情的严重程度。我的问题是，是否这一次的疫情将会比 SARS 更加的严重，死亡率和感染率是否会更甚于 SARS？
刚才问的是两个问题。
Well, you asked two questions. I will ask Vice Minister Li to take your first question.
这个关于您所关心的问题啊。
On the question you're interested in, well, it is about the measures we have taken. Well, transportation is just part of the measures we have taken. So far, the measures we have taken are in line with the evolvement of the outbreak, and all the measures can be adjusted under the law and the relevant regulations, and the measures are the toughest ever. If you look at the whole world or in China, these measures are based on years of experience. If these measures can be effectively implemented, then experts estimate that the spread of the infections can be curbed, and the transmissibility can also be weakened. The transmission peak would also be slowed. And this would buy us more time for further prevention and containment of the disease. As for the second question you raised, it is about the further involvement of the infections, and we all follow very closely this issue. And based on the knowledge we now have, this is an emerging and new disease. The knowledge we have is quite limited. We are not very clear about the source of the disease, and the infections are not entirely under our control. So based on the changes and the involvement of the infections, we would continue to improve our measures and implement our policies so that we would be fully prepared, and we would enhance our preparedness to respond to the possible changes of the infections so as to meet our goal of containing the disease. Let me also add a few words. That is a very good question you have raised, because transportation, especially the transportation system and the conveyances, are a possible way of transmission of the disease. So some cities have imposed some travel restrictions. Those are necessary because they could effectively cut off the transmission of those virus. And I believe many of you have noticed that yesterday Beijing has suspended the operation of shuttle buses, intercity shuttle buses coming in and out of Beijing. Well, the operation is already on suspension for 4 days, and we would extend this suspension. You may also notice that in Shanghai there is a subway line that connects Shanghai to Suzhou, and at 1 p.m. today it will no longer go further to Jiangsu. And the purpose is to cut off the transmission of the virus and to contain infections. And we believe these measures are effective. Well, as the Chinese people often say, only those who wear the shoe know whether the shoes fit or not. So we believe those are effective measures taken by local authorities. And I'm sure you have noticed that in addition to the measures I have already mentioned, taken at the transportation system, for shuttle buses or coaches, train stations and airports, we have all made instructions, that is to ensure ventilation, disinfection, and screening. There are also observation rooms at those checkpoints. Those with fever or high temperatures will be put under observation at those observation rooms, and they will be later handled by the health authorities. Indeed, measures have been taken by local authorities in light of their local conditions. And I also want to make something clear, that the measures taken by certain